So thank you all so much for coming. I love the fact that our forums are busting rooms at the seams. This is a really good sign. We're excited to have you all here. My name is Dr. Brian Bantam. I am professor of theology here at SPU, and also the co-director of the Social Justice and Cultural Studies major, along with Dr. Siegel. I am not the food person. So Dr. Siegel's events have food and tea and cookies and it's like a party. I'm not Dr. Siegel. I'm kind of boring, so I'm sorry. I'm trying to, if I figure if I'm around her long enough, it'll kind of, by osmosis, I'll become more fun, but not today. So bear with me. But I just want to take a really quick minute to introduce you to the major. Again, this is our first year. We're just launching the first class, Introduction to Justice, Equity, and Inclusion will be offered in the winter. And the Social Justice and Cultural Studies major is designed to really help students begin to discover how to analyze and identify inequity, gaps, all of the various different isms that we find ourselves in the world. Basically, what are the things that make us less human? What are the things that cause us to treat one another inhumanely? And what does it mean to begin to imagine a new world together, to speak a new world together? Perhaps this is through law and a pre-law track. Perhaps this is through art and social change. Perhaps it's through studying the environment and ecology. Perhaps it's going on in further study with cultural studies. And so we have a number of different tracks. The major is very, very small and highly adaptable to the needs, your sense of calling, to be able to work alongside a double major. If you feel like you want to do medicine or art or political science, and be able to really kind of have both a sense of history, literature, understanding of systems alongside the kind of hard skills of other things we require. So we'll have some flyers, I think, for the major.
Yes, right in there. If you're interested, you can come grab a course catalog and file it.
Yeah, after we're done. We will be having, if you're planning on doing the major and you haven't picked an advisor yet or signed up, please do that as soon as possible. Dr. Siegel and I both have lots of advising times available. If you're also interested in exploring study abroad, or we have another flyer here at 3 o'clock this afternoon. We also have a panel discussing internships and other vocational possibilities. What is it you can do with social justice major? What does that look like kind of post-college? That'll be at 3 o'clock in the next room. All right, so first I just want to introduce Dr. Max Hunter, Director of Pre-Professional Health Sciences, and he'll introduce our guest. And again, I just want to thank both of you for being here and taking time out of the afternoon, and everyone else for cramming into this room to be with us for our conversation today. So let's please introduce or welcome Dr. Hunter.
Thank you. This week, my youngest child turned 6 years old. He's Little Max. Some of you have seen Little Max. You experienced the energy and the passion of him. And so one of the things my family wanted to do is, well, we always do, is on the day of the birthday, celebrate his birthday. And so my family ended up, minus me, going to this restaurant or this cafe in Green Lake called Blank Space Cafe. Has anyone ever been there?
Yes.
Yeah. And they're famous for this dessert, and I had never been there before, and I'm actually going to church down the street, so I asked my wife, how did you find this restaurant? How did you find this cafe? And she said, I searched the best desserts in Seattle or something like that, and it came up, and it turned out to kind of be like the best. Sometimes you search the best of Boston or Seattle Chinese food. I don't know if you do that, but I do. And when you go or you see what's on the list, you're surprised the names that appear on the list. Well, today we have one of the best of Seattle. You didn't see that coming?
Wow, man.
so, they have the best. You look at the list, the best in Seattle are top 10 every year, and you hear these names, and sometimes you know the people when you go, good, but best, I don't know. This is truly one of the best iconic physicians in Seattle. And I'll just say earlier this term, at the beginning of the term, I had the benefit of spending time with Ed Taylor, a mutual friend of ours, who's the vice provost at the University of Washington. And unsolicited, Dr. Danielson's name came up, and Ed, who gets to spend time with people like Bill and Melinda Gates and who's who not only locally but globally, was confessing to me that, don't give me that look. How he follows this guy around trying to absorb some of his goodness. Okay? So with that, I'll give you an introduction. So Dr. Ben Danielson, a 1992 graduate of the University of Washington School of Medicine, a children's hospital pediatrician and director of the Odessa Brown Children's Clinic, is here with us today. He's been named by Seattle Times a quiet hero of healthcare, whose work helps shape children's lives and extends to support an entire community, and he's known primarily for his humility and modesty. But his work has deep roots and broad impact for the city of Seattle, and I would say nationally. He was born in Boston, but was then placed in foster care, and he describes himself as being rescued from foster care, and has a long, very interesting, touching story, and hopefully he'll share a little bit about that today. I don't know if we have enough time, but he went on, after growing up in Montana, or
high school in Montana, yeah.
In Montana, spending time in Montana, as you can imagine, black guy in Montana, went on to Harvard University and then studied medicine at the University of Washington. And he's been at the university, at the Odessa Brown Clinic since 1999. Is that correct?
That's right.
So we're going to give you a chance to tell your story. I'm just introducing you, but I'm going to start with a question for our students, and then we'll move on to the better stuff. What are you reading now, and why?
First, can I just say thank you for inviting me. This is, it's always inspiring. You never hear how much it actually feeds the people who get to come and spend time with you to be a part of a session like this. So just thank you for letting me be a piece of this space for a few minutes. It's really an honor. What am I reading? So I'm embarrassed to say, but not too embarrassed, that I'm the second time through reading Stamped from the Beginning. I don't know, has anybody read that book?
Tell us more.
The major hasn't started yet.
It's kind of a comprehensive history of this country's relationship to racism, starting before this country was a country. And for me, it's thick reading. And in these days, it's also very circularly informing. There's a lot of themes and concepts that still feel very much present, and some strategies and tactics that feel very much part of past strategies and tactics.
Okay. Great, awesome. What have you read? What were you reading before that?
I don't know. I think I alternate sometimes something that's just pure fluff with something that's deeper.
So you don't want to tell us, okay? Right.
I read a lot of like crime novels sometimes. I reread Langston Hughes and some sort of Harlem Renaissance writing, that kind of thing.
All right, awesome. So why don't you give us a sense of your story and how your life narrative informs and sustains your work?
My story. I think
Briefly,
you covered bits of my story. I was born in somewhere in the Boston area and went into foster care for a little bit, not as long as most, and then somehow ended up in a foster home in Michigan, and then was rescued from foster care by my hippie mom, Jude, who is now retired from the Forest Service, and she went to the place where most hippies in the Northwest go, of course, Eugene, Oregon, and she's very happy. We grew up mostly in DC, and my mom, who's white, and my sisters who are white, my mom made a very intentional decision to, I think, to live in inner city DC because she wanted me to have an experience in a black community and have some of the opportunities that she felt like as not black that she couldn't offer. So that was a piece of her decision for us to live in DC. And we bounced around the DC area for a while, and I was getting in lots of trouble. And my mom had sort of deferred her own dreams of becoming part of the Forest Service. And so she chose to make a change, both out of necessity, I think, and opportunity. And so I finished high school in Montana, and then went back east for college, and then came out here for medical school and stuck around.
Okay. So what fuels your work? What drives it? I mean, you're not just any physician, right? So you're thinking about big problems in the community.
Mm.
So how did that emerge for you or out of your life?
You don't go very far, even in the medical school and early training part, before you realize that there's a great benefit in the technical and academic learnings that you gain as you go through your course. And you realize that there are places where you know that's going to not hit the mark. That's not going to really get to the roots of the things that you care about. And I think that's true probably in law and business and medicine and other sciences and arts. And if you notice that, then you have to sort of do something to complement what is your structured learning and formal learning, maybe with what is your own personal learning. And you create that path for yourself, right? I know a lot of you are doing that already in different ways and in different circles. And it becomes sort of a lifelong thing for you. And for me, I realized the kids I most wanted to serve were being so poorly served by so many parts of systems that often illness was really an endpoint, a very distant endpoint from many of the things that were impacting their lives and their opportunities to thrive. And so I started wanting to understand that more. And so started joining groups of folks who are working on things. I started with actually foster care system stuff. Wanted to understand how our state's foster and welfare system worked. Mm-hmm. Joined a few committees, became part of this guardian ad litem service, and then learned about how some of those decisions are made, mm-hmm. and started to become more involved that way. And then after residencies, became more and more involved in other things.
Okay. So how do you read community? Do you have a analytical lens you've developed intentionally, or what informs your community read?
It's a really good question, and a constant question, which is, I hope I never fully answer, to be honest with you, because I'm probably embarrassed by some of the responses I would have given you even 5 years ago to that.
Okay.
Community
Could you explain, maybe say something like what where those responses might have been?
I think I stereotyped community. I think I used it as this filler word for, like, anytime I wanted to say something about a group of people, and I meant it honorably, and I wonder if sometimes it was also just over categorizing or convenient for me but not descriptive of what I was really trying to work towards. So community is interesting. I also think today, as we've seen our community really blown apart by gentrification, and we still see so many of the same families in our clinic, but outside their clinic walls, it's changed dramatically. When our clinic first started almost 50 years ago, the neighborhood around it was 73% African American, and today it's like 9% African American. And similarly, low-income families used to live very close and could almost walk right to our clinic. Now they take 2 buses or spend an hour and a half to get to the clinic. So things change, and suddenly for me, just linking back, I used to think about community geographically, and an opportunity in thinking about things and the ways in which you'll probably solve problems in the future is very free from some geographic banked by Madison, Rainier Avenue, 12th and 34th Streets. Like, that is not the definition of community, at least not the communities that I'm involved with anymore, which is like, it opens you up, right? And you get to think about things a little bit more beyond zip codes or who's next door or who's across the street. a challenge and an opportunity. I love the opportunity because then you start to think of affinities and connections, and you start to think about generational connections, and you start to think about cultures and what people value and how those values are shared and how they're different, and then suddenly you become embarrassed by how you talked about community 5 years ago.
Okay. So with that in
That makes
mind,
sense? Sort of, no.
So with that in mind, and looking at the fact of our audience being young, if you could go back to yourself as an undergraduate and knowing where you're headed, what would you tell yourself to grab along the way for your toolkit?
I would hold as close to my heart as possible curiosity. I think curiosity is sometimes the cure for stereotyping and bias. I think curiosity is the gift that keeps your mind open when it wants to sometimes close and go for convenience. I think curiosity allows you to embrace complicated questions and complicated answers without feeling like somehow it's too hard. I think curiosity, my hippie mom would just say, curiosity makes you a more interesting person.
Okay. So you would want to be interesting. More interesting. Okay, so talk to us about how you're addressing the challenges of displacement at your clinic and outside of your clinic. One of the things I try to get my students to do is to develop a more expansive notion or ontology of what it means to be a physician.
Yeah.
Besides someone who just puts on a white smock once they enter the clinic and gives people prescriptions. So with that in mind, because your work really embodies that, right? You know, what is it? What are you doing, and what's it going to take to continue to serve the populations that you're interested in?
So my first answer to that, and I'm sorry for this slight memory lane travel, I came out of residency, actually worked in White Center for a couple of years, and then got to the Odessa Brown Clinic, and I came there with probably like a really, really clean white coat and maybe a sense that I was supposed to be the smartest person in the room every time I walked into a room. A lot of that was probably based on my own lack of self-confidence or insecurity. And so I draped myself in language, the language of medicine, with all of its itises and OCCs and pseudo-Latin and pseudo-Greek. And I tried to be the person to have the right answers. And I'm so thankful for working next to wonderful people who were patient with me and kept teaching me. And one of the first persons to teach me was this woman named Liz Thomas. She was a nurse practitioner. She was actually the first African American to graduate from UW's nurse practitioner program. And I think she watched me for about 3 days, and then she grabbed me by the ear, and she marched me almost outside of the clinic. And I always tell this story, but I really thought in my cloak of medicine-ness that we were going to look at this amazing edifice that is the Odessa Brown Children's Clinic and just stare at it and talk about the wonderful things we were going to be doing inside those walls. And she promptly turned me around and made me face away from the walls, and she said something like, you know what, out there is where your work really matters. That you have to care about the kids who never come through the doors of your clinic just as much as you care about the kids who do. And so that was a beginning in that process, and that made me at least want to understand what she was saying and what she was talking about. And I think she was ushering me into a sense that, you know, if you really care about doing something well, it's way beyond any reach of any stethoscope or any ability to write a prescription. It made you start thinking more expansively about community, that word you started with. Over time, I think it's also opened up opportunities to be more involved in things. And because I'm a big whiner and complainer about systems, I also felt like when people wanted me to work on changing systems, it was very hard to say no, because then I would have been rather hypocritical. Do you know what I mean? I could complain a lot and pound on the walls, but if somebody invites you in and say help make things different, it's a real challenge to you to do that. It's also a hard decision, because you might be compromising something as soon as you walk through those doors. But being parts of groups at the county level, and then at the state level, and at the national level, to try to be somewhere near the table when decisions are being made, or understanding how decisions are made, or how to navigate decision making. It's a really interesting path. Things like that sound really mundane, like there's this thing called a Health Benefit Exchange Board, which was the ACA's sort of manifestation of putting healthcare into states and helping people sign up. And very, very boring operational approach to getting people a chance to use basically like a kayak or an on-site web-based opportunity to sign up for healthcare, that kind of thing. But constructing that was really challenging, and being a part of that conversation from the beginning and doing the battles both nationally and at the state level to fund healthcare opportunity was important. And the biggest sacrifice or compromise to me was I think our healthcare system sucks and it should be broken down, and we should have a nationalized universal healthcare system. So I'm at the table helping to prop up a system that I don't totally believe in, but hoping to make it a little bit more accessible to the people I believe in. I'm gonna stop there.
All right. I want to ask you why 2 watches, but that might be a question. So, what's driving you now? When I used to be editor for the Preventive Perspective, which is a social justice center here, when I would invite writers to write for us, I would ask them, they would ask me, what do you want me to write about? And I would say, well, what's percolating on your heart? What's on your heart right now? Because whatever that is, people are going to feel that, and it'll be interesting. So what's imminently on your heart? For the city or for the nation or whatever?
On my heart and on my head are interesting things. They intersect a little bit, but not totally. What's on my heart is, one is whether I am a very small part, and not just in the color of my skin, but in my political beliefs, of a tiny minority in a country that is otherwise has a very different sense of beliefs, and trying to understand whether that's true or not. Related to that, how to have, I can't find the words exactly, so I will say aggressive, intense, and intentional acts of kindness and love as a counter to what I think are aggressive acts of fear and hate, and how we can demonstrate actively, not just with good words and with hugs and good intentions, but actually intentionally demonstrate what the power of kindness and love is, in contrast to what is so much around us that are acts of fear and hate. Does that make sense? I believe so much that we, especially we when we're different, and we when we care, and we when we're curious, and we when we work together, have an incredible power that is not seen or talked about right now in this country. And there needs to be a bit of a counter to divisiveness and to fear. And I think we need to show that. And you can do that in small ways, and you can do that in big ways, but you've got to do it. That's what's in my heart.
So with that, I think we'll open the platform up to questions. So I'm sure we have a lot of folks here from different disciplines. So ask some questions. Ask Dr. Danielson some questions.
I won't answer the 2 watches.
I have a question while people are thinking. Sorry, I will do the ring voice. So you in the beginning, you talked about the book you were reading, Stamped from the Beginning. I would love to hear how a book like that, so a book that's basically history, how does that inform your work?
I think it's, if you are on the same page, as the book, I think it's really interesting to acknowledge that racism is so fundamentally built into the construct of this country, and even before it was a country. I think that's incredibly important. There's so many reasons. One small one is that we sometimes get divided in different circles because we think if I talk about racism, that means I don't care about ableism. or other isms. And that is such a great way to keep us from working well together. And I think that in understanding how foundational that model of racism is to our history, it helps you have that platform and then also construct your understanding of the many other ways in which we push people apart and marginalize them. I think that understanding that the way things work today is actually it's not a broken system. It's actually a system working exactly the way it's designed, and those designs go all the way back to the roots of us as a country. And if we're afraid to say that and talk about that and know that we embody that I have absorbed all of that and expressed that in different ways in my own biases, if we're afraid to acknowledge that, then we're sort of blind to who we are and where we are in the world. So I think there's a piece of that. And I think there are both strategies and scary things in that history as well, because they do repeat themselves, or they're ignored. You think about, I wouldn't have known about the Immigration Act of 1924, which was sponsored by a Washington state legislator who was mostly trying to keep Asians from immigrating to this country very well, and created basically a quota system for immigration. And I both see how much that sounds familiar today, and it scares me to death that Trump or one of his advisors would read that language and want to reintroduce it, just like he's trying to deintroduce issues like the 14th Amendment. So there's this history that helps you understand what's happening and maybe prepares you to be a change agent, not a victim.
I imagine it also lets you hear the echoes of rhetoric that are oftentimes floating through policy decisions or things like that as well.
Yep.
So you mentioned at the end that you talked about aggressive intent for loving others. I just love that, but I wanted to know more of how you do that besides just, well, I know it's more than just saying good words and like showing, giving them hugs, but I was wondering if you can like elaborate more on like how to actually do that without the superficialness of it.
Thank you. Yeah. So moving way away from the superficialness of it, I'm partway into working with a bunch of people to try to build a new clinic, and it's partly a response to this displacement of so many low-income and communities of color around our neighborhood, and it's partly just this necessity that that kids especially, but families need. Out of that, I feel like there's an opportunity, and sort of at the end of that is almost what I would consider serendipity, because we're going to be able to build this clinic on this campus, which is like 3.5 acres, that will have these other services. And oh, by the way, over time we've really decided that the best performance indicator for our medical, dental, mental health, and nutrition clinic is actual school preparedness. That school readiness is our KPI, key performance indicator. And so on this new campus, in our same building, we're going to include an early learning center, and we're going to co-destine. Is that a word? We're going to co-destine our work around that and operationalize that idea. And that's an idea that the healthcare system is really fighting against and rejecting. An insurance company doesn't want to pay me for school readiness measures. A hospital that puts up with our many dollars lost every year doesn't necessarily want to support that. But I know that is actually the best measure of a young person's opportunity to thrive in this country no matter what. And so it feels like the right thing to do. So I'm getting people mad, but pushing this agenda of creating a clinic that's based on the social determinants, including things like economic opportunity, that houses the social basics, like having a food pantry and working with the Northwest Harvest on having sort of pop-up food opportunities there, that understands basic needs. And we pay rent sometimes, we buy beds for that kid in school that looks like they have a behavior problem but just haven't slept that night. We go to schools and we bring food because some of those kids that look like they have ADHD just didn't eat breakfast. We do those things that that I think are kind of intentional, loving things that also push up against the systems that we're supposed to sort of stay in our lane on. Part of the answer. The rest of that campus also has adult learning opportunities and educational advancement, ESL, GED, those kinds of things. And I think that's really important because another embarrassment for me is that I've been working just long enough to see generations of kids, which is awesome. Like, really love that. It's really weird and amazing to see the person that you were the pediatrician for whatever years ago now holding a baby. What's not awesome about that is that same family is still in poverty. And I have lovingly cared for those kids with good intention, but I have not intentionally and lovingly made sure that those families are moving out of cycles of poverty. So a campus like this has a chance to do that intentionally, assertively. Finally, I traveled all over, not all over, I went to many places around the country looking at models of healthcare, kind of working with people that I knew at different national groups and looking at their programs. And I found many that were wonderful and laudable. I found two huge missing components that we're able to solve in this model. One is that one of the biggest social determinants for this hourglass-shaped, poorly constructed county is transportation sucks. And so you have to have a transportation-based solution to providing services, or else you will just find yourself in a little space that is also hard to get to, no matter where you locate yourself. And two, I saw many clinics that were wonderful, and then they found themselves, just like we are, subsumed by a wave of displacement. And what this campus has above every one of those things I mentioned is housing. And what's across the street is low-income housing. And what Ed Taylor is working on is being part of the educational presence in that space. This opportunity to really solve problems assertively, intentionally, on purpose, pushing you together, integrating your efforts, is a piece of that, doing it differently, doing it with love, but showing people what can happen when you work together in that loving way. At least that's my construction of it. I don't know.
I think that was wonderful. Thank you.
You mentioned earlier your desire to improve access by implementing a more universalized system. Do you think that could work in America in addition to a private system, or do you think that America should move more in the direction of a universalized system? And if so, is it possible to do so without changing a lot of drastic things, like you mentioned, transportation and education and things like that? Or what are your thoughts on that?
That's a big one. Like, I would start with, thank you for that question while my mind's racing. So, so over time, you create your own goofy theories about what impacts well-being. And so my own goofy idea about what's even upstream from those social determinants, like educational opportunity, transportation, economic advancement, are three spheres that overlap a lot. In fact, enough for us to be confused about what we're doing and why we're doing them sometimes. So those three spheres to me are toxic oppression, which has its foundation in racism, but has its oppression in many, many different forms. A second sphere is stress, and anybody from any background can experience great stress in their lives, and it affects your well-being. And the third is toxic capitalism, and I used to call that poverty. And then over time, I think I've realized that we have a problem in this country with capitalism more than poverty, which makes people who are poor not able to thrive, not able to be well. But it doesn't have to be, in my mind, that you need to be sick just because you're poor. That to me is a manifestation of toxic capitalism. And I think the truest expression of that is that we prop up a capitalistic healthcare system that does not perform well for any of the outcomes that you can measure, when we absolutely know that a non-capitalistic healthcare system would make people healthier. We make that choice every day, and we continue to make it. And so my overall answer to you, maybe if we weren't so toxically capitalistic, we could have a combined market and universal healthcare system. But we are so toxically capitalistic that that wouldn't really work too well in this country.
Alexandria.
Hi. Sort of building off the prior question, how do you see the transition going from our current privatized system into a more equitable national healthcare system? What steps do you think would need to happen in order for that to occur?
Another great question. And it's also the source of ethical dilemma for people who work in spaces and places like I do, I think. We have a couple of ethical dilemmas that you have to kind of face all the time. I'll mention yours second. The first one is, are we doing work just to keep our own entities going, or are we really doing work for the betterment of the communities that we serve? Because sometimes you get really twisted into I don't know, your justification starts to be, we need to be sustaining so that we can do our work, when it should be, we need to make sure that people are getting what they need. So that's the first one. And you have to keep asking yourself that, or else you're going to go off into sort of narcissistic service. Oxymoron. The second one that relates to what you said is, if you do good work in service provision, especially in a place that is in many ways considered like a quote, safety net, unquote, then the better job you do, the more you allow that system to continue. So every day that I do a good job, if I do, or the people around me do a good job and hide my not so good job or whatever, I'm actually propping up a system that I don't feel is a good system. So one answer would be all of the federally qualified healthcare centers, all of the community clinics, all the safety net systems, just stop. I wonder what would happen. A lot of harm would happen in short term. And so that, my heart doesn't allow me to feel good about that. If you talk about change, that might be a piece of change. I think some level of working together in a more powerful way to express that need to make a better healthcare system is really important, and most of us find ourselves so busy in the day-to-day, so overwhelmed by what's right in front of our noses that we silo ourselves, we don't work as well together. So some stronger level of collaboration would be an important component of reimagining what our healthcare system could be like.
And would that collaboration be between physicians in allied health, or physicians and people who make laws, or people who study the economy?
All of that. Yeah, and I think, so a clinic that's worth its salt should probably be pretty involved in political activism, and should be involved in something we're talking a lot about in our clinic around taking at least as much of the hierarchy out as we possibly can. So I still feel weird now, because in the clinic I don't get called Dr. Danielson, so when I hear it here it feels a little weird. But the idea of expanding who is considered a health provider and what health means and what wellness means is a bit of an important journey that I think is really potentially rewarding, and could be very transformational. We have a lot of hierarchy built into our systems. It's not a surprise in a way that an MD is the director of the clinic, when I know a couple of nurse practitioners who could do that job extremely well as well. I know a couple of community activists who could do it really well too. There's a long ways we could go along that path.
Thank you.
I'm rambling, I'm sorry about that.
Oh, please do.
I have heard talk very passingly about hospitals or clinics being paid more if they have fewer admits in a hospital or something like that, as a form of encouraging the structure that would support people so that they wouldn't have to be sick in the first place. Is that something that you see actually, do you think that will come to fruition? Do you think that's something that will be really helpful? Do you think that movement will allow your, this dream clinic, which I really hope does become a reality, do you think that would help the formation of that?
Yes, and. And a little bit of this is reminiscent to me of the equity equality conversation. What do I mean by that is I think we all would strive for a place where things were so fair and even that you could then assert a value of equality, and then things would really work in a good way. As long as you have systems that are really stiltedly set up to I made a real corny line, and I did the UW commencement this year, and I said something that was really dumb about, like, some people just get lifted up in their lives on warm thermals and they're just going to succeed because every system is there to make sure that they do. And some are just pulled down by cold vortices that take an extreme amount of effort to even hold your own in the face of. You can't talk about equality when you have that kind of climate, if that makes sense. And I'll tie this to your question. One of the struggles we've seen in sometimes trying to like just say this is going to be our goal, like decreasing ER utilization or hospitalized patients, is that it completely ignores all of these social determinants of health, and it completely ignores the pent-up need for healthcare that a lot of communities face. So when you first do something that actually might be a good idea, our preoccupation with moving needles quickly, another thing I hate, makes you suddenly abandon that a good idea because you think it actually increases hospitalizations. What it does sometimes is unroof an incredible need and start to address it, and that leads to increased healthcare utilization because so many people have been deferring their care, not recognizing that they could have access, all of those things for a long time. And so suddenly your measure is actually your devil. It actually makes it that much harder for you to advance your work because somebody creates this thing that sounds laudable but is based on a very different universe than the one that you have today. I'm fighting this a little bit because I'm a really strong advocate of shifting our models of value from volume-based, how many people you see, to quality-based, like you're talking about. But unless you have a system that actually is oriented towards those social determinants and those other determinants of well-being, then, and I've seen this, we just came out with a rating of ER utilization. Every community clinic that serves socially complex, lower income families rates poorly in ER utilization, and every really fancy, please excuse me, Mercer Island kind of pediatric clinic looks really great. What does that reinforce? What does that drive, like for teachers to teach to a test? What does that make you want to exclude in your patient population so that you hit that value that you hope for? It's really important to not love a quality measure so much that it actually decreases the quality of the care that you're doing. So that's my random response to that.
Any more questions?
What's like the biggest challenge that you face in trying to administer the care to the patients that you have currently?
The biggest. Sometimes I feel like I'm protecting kids from my own system a bit, and that's interesting to try to do that. Or advancing your work when you're not seen as a friend to your hospital or organization. That's one. That's kind of selfish though. I think the biggest challenge is just maybe the way we're set up to really separate our systems, our services. Awesome. We did this, wrote this Robert Wood Johnson grant like, I don't know, 7 years ago to bring legal representation into the clinic. It's called a medical legal partnership. It's an awesome thing. And you bring these people with different beliefs, with diverse approaches and diverse skills together, and the amount of ways in which you can creatively solve problems just exponentially goes up. I've just seen that over and over again, and I love that idea of bringing people who would not work together to work on things. And it's amazingly successful. The medical legal partnership, the lawyers, they wear super capes to me. They do way better healthcare than I do in many ways. And they teach me not to write like flowery poetry when I'm begging somebody a landlord not to kick their family out. You know, now I know how to directly refer to RCW code and say whereby and whereas, and by this date you better fix this or else. So I'm a better social advocate too. That's a small example of bringing unusual people together to have unusually creative responses to what I think are really complicated challenges in our society. It's very inspiring to me, and it's one of the hardest things to get to do. You really have to break down systems in order to make that possible. So that's the hard work, but it's also exciting and rewarding and fun. And maybe especially exciting in that there's so much more incredibly great work for you to do to change and improve this messy thing that exists right now. I think it's like a very, very cool time to be in those exact seats or on the floor.
Speaking of which, I feel a couple people on this other side who raised a hand, but you might not.
Oh, I'm sorry.
Okay, speak up.
At the beginning, you spoke of creating your own path and keeping your mind open to new curiosities. What would you consider your best advice for upcoming healthcare professionals?
Learn about cultural humility is one thing I think about, because I think it extends well beyond the way people sometimes think about that phrase. I think cultural humility, the number one part of it is like seek to know yourself before you start to decide what you think of someone else. So that feels like a full life kind of thing that would be really important for anybody, but especially in healthcare. Again, because we tend to really want to be people with answers and be thought of as smart. That's a dangerous thing in many ways. Other tenets of cultural humility are really about positioning yourself as a constant learner, so that curiosity piece is sort of baked into that. In medical school, a mentor of mine said something like, you should always hope that wherever you go in life, you're always a teacher and always a student, and that dyad is an important component of who you are wherever you are. Cultural humility also means that what you care about most isn't necessarily the only thing that matters, so that you actually compromise and negotiate and think about ways in which to change what you do so it fits somebody else's needs more. I would love for that to be as rigorously tested on my boards as any other component of diabetes management or histocompatibility or anything like that.
Hi, sorry, I'm kind of jumping around. In my experiences with pediatrics, a lot of times there's a huge emphasis on preventative care. So I was wondering how you're able to do that when there's so many factors you can't control, like food deserts and education, and when there's so much going on in the family's lives right now, how are you able to look in the future?
Not well, totally, because of some of those challenges that you were asking about and we were talking about. But sometimes you have to take advantage of what you have, and so in a way we've made child care the platform for a lot of the other social determinants work that we do. So since that's the thing that is at least recognized in the healthcare system, a preventive visit like a checkup is acknowledged as something of some value on some level. Even though we lose money every time we do that, it's still at least something that is acknowledged. And so we use that as this platform for when we have our visits. And in a future state, those visits are maybe even more integrated in that you might say it's a checkup, but you start with just who do you want to be in the room today supporting you? And that on some days that could be our nutritionist, our social worker, and a lawyer. And other days it could be the dentist, the WIC nutritionist, and the doctor. But creating this sort of platform, just using what you have, which is a healthcare system that somehow values a system of checkups. So we use preventive care in that way. And I think there's a whole lot more we could be doing better and better, right? Like we try to get away from checklists, and we try to think of our opportunities to understand the things that are expected of you to ask as sort of this continuous conversation that happens over time. And the most important thing I hope I try to do, she's my sort of secret shopper in that, but is really ask parents what they want to use that time for. I don't know if that answered your question at all, but
No, it did.
Okay.
Thank you.
We have time for one more. I think there's one up here.
Yes? Oh.
So I was wondering, how do you stay balanced as like a person and a healthcare provider? I feel like that's, I think everyone kind of attests to that.
You're noticing some imbalance in me. I see. No. I think that's a really good question, especially because, you know, I started off this ranting with, these days things are actually, I think, harder in terms of just the nebulous floating external things out there. So whatever you want to call it, let's just call it self-care, is especially important. The wonderful gift of working in a clinic like I do is that you're surrounded by these other incredible people who actually care about you in addition to caring about all of the families they work with. And so I doubt that I can like fall too far in my life in general without all of these people actually checking in on me and taking care of me and pushing me. There's always somebody I can just say, wow, that was a really hard moment I just had. Or I just got back from, I call my boss the principal. Like, I got back from the principal's office and just got, you know, chewed out for losing more money or something like that. And there's somebody there who supports you, cares about you, knows exactly what you're talking about, and is part of your family. That work family is a really, really important thing that I don't know gets talked about as much in this sort of conversation about self-care. And then, like, I don't know, you spend like a minute in a room with a family, and if you're in pediatrics, it's so selfish because kids make you feel better, and they do all these amazing things, and you watch them grow, and they inspire you, and they make you feel like no matter how hazy and hard today is, if you see that kid's eyes, you know that future is going to be better. I see your eyes, I know that future is going to be better. And so you sort of get recharged in this particular profession almost every moment of every workday. So I get to cheat. And then like a kid gets sick and they actually get better faster on their own than adults do. And then I look good because I'm like, somehow it makes me a good pediatrician. It's really, it works out really well. So.
I want to thank you so much for being. And I mean, I think one of the things that was just inspiring to me as I listened to you are kind of a couple things. So one is the kind of power and possibilities of the and. Like what happens when we kind of confront a problem and we always ask and we never exclude the and. But the and is always in front of us. The doctor and the lawyer, the preschool and the clinic. You know, the tool and the book. I mean, so like what happens when we kind of open up stuff, that's actually a possibility, and we hold that in front of us all the time. And I also really want to thank you so much for the reminder that we can be at the top of our profession and still need people. And that there's actually a deeper, more profound freedom that we have, that we're better at our jobs when we recognize that we need new knowledge, we need others' expertises, we need other partners to do the work that we do well, that we're not somehow singular super people. So I thank you so much for that time. So let's give...
Thank you.